Hello, my fellow broke aristocrats. Today I'm answering a question from one of our viewers who asked how you can increase the amount of oxygen in your body. This question is coming from Court Shannon. Hello, Court Shannon. Yes, I would love to answer your question about how to get more oxygen to the body. But before we get started on that, we're going to have a brief conversation about what oxygen does. Oxygen is important for various different processes that take place in the body. How do we usually get oxygen in the body? Well, the usual way we get oxygen in the body is that we breathe. We inhale oxygen, and then the lungs, they have a section in the lungs that's called the capillary bed. It takes up oxygen and carries that oxygen on red blood cells. The red blood cells capture that oxygen and then carry it to the tissue, and the tissue uses the oxygen in order to do certain things. An example of one of the things that the tissue does with oxygen is it allows for aerobic fuel, to burn fuel to give energy. That's what we call aerobic exercise. Aerobic exercise burns fuel. We burn calories with oxygen. So it's very efficient. The more oxygen we have, the more efficient we are at using the food that we consume and giving ourselves energy. This is very different than anaerobic, which is less efficient. Anaerobic is our ability to make ATP, or the units of energy, from glucose without oxygen. Now, some of the challenges that can happen that can decrease our ability to take up oxygen, the first thing I would think about are COPD, and that is chronic obstructive pulmonary diseases. Examples would be emphysema or asthma, where the person is having trouble taking in oxygen. They're slightly different types of diseases, but they both are diseases that can have an impact on how well you can take up oxygen. Another challenge that may happen if a person is struggling to take up oxygen, I'll give you a couple more examples. One is severe anemia, and that's because a person doesn't have adequate red blood cells. And so even though a person may be exercising and the lungs are taking in plenty of oxygen, if you are deficient in the amount of red blood cells you have, then you would be unable to carry that oxygen to the tissue. There are other challenges as well. For example, chronic inflammation in the body. If the body is inflamed, can have an impact on whether or not oxygen can get to tissue. Certain types of diseases, we're now looking at whether or not oxygen can adequately get to the tissue. An example would be fibromyalgia, which is described as a condition of chronic pain. It's not an autoimmune condition, but it is a condition where people seem to have a very low threshold for pain, and we suspect that the tissue is hypoxic, not getting adequate oxygen. So what are some of the things that you can do to increase oxygen in your body? Well, it depends on what the medical condition is that we are addressing. If it's a case of COPD, then obviously your doctor would be prescribing various different medications in order to increase oxygen exchange. But exercise can be helpful, because when we increase our heart rate and exercise safely and effectively, of course you want to talk to your doctor about what's safe and effective for you, you're going to be increasing oxygen because you're going to be increasing your breathing. Of course, if you have asthma, you want to be careful if it's a form of asthma that's aggravated by exercise. So you might not want to be, for example, jogging in cold weather. That can sometimes, cold, wet weather can trigger asthma. If it's a case of anemia, then we would prescribe necessary medicine like B complexes and iron. The most absorbable form of iron, I find, is the iron bisglycinate or ferrous bisglycinate, and that is the easiest to digest. You want to find out what the underlying problem is, why you are not getting adequate oxygen. Moving, breathing, number one way to get oxygen into your system. If you have COPD, we have found that massage can be helpful. That's where the patient with COPD goes to a physical therapist or a trained massage therapist that can literally push the CO2, those are the waste products that are coming from the cell that are expelled in expiration, can push the CO2 out of the lungs with the assistance of the patient, pushing out that dead space, pushing out that dead air so that the lungs can take in the good air. So the patient would take a breath, then we would push the bad air, the bad air or the CO2 out and allow for healthy better function of the lungs, taking in oxygen. If it's a case of fibromyalgia and hypoxia, and you feel there's some cramping or pain due to a lack of oxygen getting to the muscles, so the muscles are having trouble, you might see cramping or pain in muscles that are not getting adequate oxygen because they're not able to produce burn energy, and so they cramp. So in a situation like that, we would recommend massage. Obviously, if a patient is in extreme pain with fibromyalgia, we have to be very careful about how we massage the patient so that it meets with their pain threshold. Some of the medications, or the supplements that have been used in addition to a B complex with iron for women if it's a case of anemia, but some of the other stuff that we've been looking at, if it's a case of COPD, can be various different types of herbs and nutritional supplements that can help get inflammation down and increase the lungs' capacity to take in oxygen. Examples would be turmeric. Turmeric has been studied for being beneficial to COPD, but also some of the herbs that are found in essential oils, believe it or not. Just having eucalyptus infuser, whether it's in an infuser in your baby's room if the baby has croup, or if it's in a person's room who's having some slight sensitivity to the air, that can also help. Fish oil has also been studied because it has anti-inflammatory properties. We can't call it an anti-inflammatory because that's a class of medication, but we can say that it can reduce inflammation, and this is why fish oil has been studied for reducing inflammation associated with COPD. So that is basically everything I have for you in terms of increasing oxygen. Get out and move, exercise. Lung exercises. If the condition is COPD, you can talk to your doctor about physical therapy or a massage therapist. Making sure to get B complex and iron into your body if it's a case of anemia, and various different supplements like turmeric and fish oil have also been found to be helpful in terms of getting inflammation down if that's part of the condition leading to hypoxia or low oxygen. All right, that about wraps it up. I hope I answered all your questions, and if any of you have any more questions for me, I would love to answer them as well. All right, thanks for watching, everybody, and we'll see you next time. Take care. Bye-bye.